Okay, in the next few slides, I'm going to explain to you the effects of two kinds of hormones, insulin and glucagon. These two hormones are extremely important to control the blood sugar concentration in your body, and I'll explain to you what happens when the amounts of hormones are either overly produced or underproduced. Okay, and as you may know and as you may expect, it will cause quite detrimental effects to the body. So what does insulin do? You should kind of know this by now, based on chapter 6 on digestion. You know that insulin hormone actually helps to decrease the blood sugar concentration in your body. Okay, and it's usually released when you have taken in a large intake of sugar, or like after a big meal. Okay, your body has a lot of carbohydrates, which means a lot of sugar, and so the insulin is being produced in greater amounts. Okay, so how does it actually cause glucose levels to drop? So these are the things that may be a little bit new to you. So the mechanism at which insulin works, right, is to increase the rate of glucose uptake by cells. So it causes cells to basically take in more glucose and break it down. Okay, it also makes cell membranes more permeable to glucose, so glucose are able to move through the partially permeable membranes into each individual cell. So this actually causes the blood glucose levels to drop because the glucose moves into the cells. So what it does is that it stimulates two kinds of cells, the liver and the muscle cells, to convert glucose into glycogen. Alright, so besides this, it also does this. So you just need to know that the effects of insulin is threefold. Okay, this you might not have learned earlier. First, it increases rate of glucose uptake by cells. Secondly, it makes cells more permeable to glucose. And third, it converts whatever excess glucose left into glycogen. This happens in two places, liver cells and muscle cells. A lot of people miss out on the muscle cells, so just take note of that. Okay, and this actually causes an increase in the oxidation of glucose during tissue respiration, so it produces more energy. So this is why when you eat more, you have more energy, because there's more glucose oxidation taking place. Okay, so what happens when you secrete too much insulin? Okay, so when there's too much insulin being secreted, it causes an abnormally low blood glucose concentration, because now too much of it is being converted away. So now we have got too little glucose in your blood, abnormally low, and this causes hunger, rapid heartbeat, irritability. You know, when you're hungry and your blood glucose level is low, you are more irritated. Okay, so in severe cases, this person may even go into coma or even die. So this is why you should never starve yourself. You should never fast for too long hours, because this may actually cause serious consequences. How about a lack of insulin secretion? Okay, so when you have a lack of insulin secretion, you will have an abnormally high blood glucose concentration. So this happens in people who have genetic problems. They cannot secrete insulin. Alright, so when that happens, the tissue cells cannot utilize, they cannot store glucose, so their blood glucose level will fluctuate according to how much glucose they eat. Alright, and the symptoms include a weak body, continual weight loss because their body cannot take in glucose, and so the glucose just basically gets lost in the urine. So this is when you take a urine test, you can find glucose in your urine, and that's an indication of a problem, that your body is not able to utilize the glucose that you consume. Okay, and this is the common known illness known as diabetes. Okay, so diabetes is caused by two reasons. So there are actually two kinds of diabetes. What you're reading in this slide is known as the type 1 diabetes, where the person just is born with the genetic disorder of not being able to secrete enough insulin. So these type 1 diabetes patients have to bring with them insulin medication with them everywhere they go. So they give themselves insulin jabs before they eat. to help them convert whatever glucose that they consume into glycogen. Okay, so diabetes mellitus, the full name of diabetes, is actually caused by insufficient insulin secretion, and this is just type 1 diabetes. Okay, it leads to persistently high level of glucose in the blood, and so the glucose cannot be converted. They are unable to be completely reabsorbed into the body. So this causes glucose to be excreted in urine. This is why finding glucose in your urine is the first sign of diabetes. So constantly high blood glucose concentration, when there's this thing known as the finger prick test, where my grandmother uses. So she basically pricks her finger, gets a drop of blood, and then you test that blood for the glucose levels. If it's higher than normal, it means that she needs probably more medication, or she should eat things that are less sweet. Okay, so there are two kinds of diabetes, like what I said. All that I've mentioned earlier falls under the category of type 1 diabetes, where patients are not able to produce insulin. So these people are usually not fat. These people are very skinny. They can't even absorb the glucose. So obviously they can't store anything, right? So because of that, they usually are very skinny. They have to control their diet. They are not able to eat like cakes and very sweet things. Okay, and they usually have to bring with them insulin injections everywhere they go. Now, type 2 diabetes is slightly different. Type 2 diabetes is a late onset diabetes. It's something that the older generation face. So like I said, my grandmother has diabetes, and it's type 2. So type 2 diabetes takes place because of obesity most of the time. So when someone eats a lot of food, okay, the body produces more insulin, but over time, because this person keeps overeating and insulin keeps getting produced in big amounts, very soon the cells of this person's body gets immune to the effects of insulin. Okay, I repeat, these people end up having cells that do not respond to insulin. Okay, so meaning in these people, because they eat so much all the time, the body keeps producing so much insulin, very soon the cells decide that they don't want to respond to the insulin anymore. And this is called insulin resistance. Okay, type 2 diabetes is caused by insulin resistance. It usually happens in obese patients. And so what is the treatment? The treatment that doctors will tell these people to do will be to eat less, control their diet, exercise, so that their body does not have to overwork to produce insulin. Okay, which may end up not being useful after all. Okay? Alright, so that's all for the effects of insulin and the effects of diabetes. Now we'll go on to glucagon. So glucagon, you have also learned a little bit about this in chapter 6. It works the opposite direction from insulin. It increases the blood glucose concentration. What it does is essentially the opposite. It stimulates the conversion of glycogen back into glucose. It also stimulates fats and amino acids conversion into glucose. Okay, so these are two things that you need to know. Alright, it has got two main functions. Usually we are very familiar with the first, but you will need to add on the second to your knowledge as well. And thirdly, it also converts lactic acid into glucose. So all of it converts to help increase the amount of glucose in the blood. Okay, so the main target organs of glucagon is the liver. When there's a low blood glucose concentration, for example, if you starve for like more than 6 hours and then your blood glucose concentration is really low, your body needs to somehow be able to get the glucose back. So it will stimulate the islets of Langerhans, which you should recall is in the pancreas, okay, to secrete glucagon. Then glucagon moves to the liver, where it exerts its function. Okay, so you can see that if you compare insulin and glucagon side by side, you will realize that they are actually produced in this cyclical manner. So over time, when insulin is produced when blood glucose concentration increases, then it causes the glucose concentration to drop. Okay, then glucagon gets produced when the glucose concentration drops too low, and then the whole effect goes on. The whole cycle repeats. So you can see that it's this alternating functions, alternating actions of insulin and glucagon that will ultimately keep the blood glucose level at a set point. Alright?